Hello and welcome everybody at today's video cast. I have a very special guest, Mr. Tom Shepard, who is the CEO at Captor Therapeutics and also a PhD in biochemistry. Hello, Tom. Welcome to my video cast.
Okay, it's a pleasure. Thanks very much for the invitation. I'm glad to be here and looking forward to our discussion.
Tom, there's a lot going on around biotech companies, not only in Poland but globally. The brands are accelerating, and now you decided to come across with Captor. But before we move on to the Captor itself, I would like to ask you about your story. What's your background and previous experience in biotech industry?
Yeah, well, I'm originally from Scotland. I have a bit of an accent from the largest city, Glasgow, where I got my biochemistry qualification, as you mentioned. My first job, however, was not really in the strictly speaking, the biochemical research. It was in fact, in clinical trials. My first position was with the company which is now Novartis. But however, when I was there, I quickly realized that I had a bigger interest in business than the pure science. So I moved into the marketing department, launched some products for Novartis. And then after a few years, I found myself attracted by the idea of biotech and joined a small startup. And from then on, I've really been focused on primarily biotech companies, initially in business development, licensing, and then subsequently in general management as CEO of a few companies. I've held those positions in a number of places, the US, California in particular, UK, France, Australia, Switzerland, and now Poland with Captor, which is an adventure I'm really excited to be involved with. I've been in both large and small companies, both as founder, but also joining larger companies. So I've really had a lot of experience of everything from really the very small and growing and evolving these companies through to having products on the market, etc. So that's my background, and I think for that reason, I can really complement the exceptionally strong science that we have already at Captor, and that's the thing that really brought me here.
Okay, so moving on directly to Captor, what caused that you crossed paths with Captor? What in particular attracted you to Captor as a career goal?
Okay, yeah. So was a few different things that contributed to that. First of all, a few years ago, a friend of mine introduced me to Michał Warczak. When Michał was really building the science at Captor, and we had a few discussions regarding, because he was already looking ahead about the business aspects of the company. I mean, obviously we had to build the science first and then the business. So we had conversations a few years ago, and we agreed that we would keep in touch. And when Captor had got to the stage where it really needed some extra horsepower on the business side, that we could consider working together. And as a consequence of that was one thing. And I remember at the time, because when I was talking with Michał, I was quite excited by what he was saying about targeted protein degradation in the future. And in fact, coincidentally, I had been CEO of a company in Scotland, which actually one of my personal friends was one of the leading professors in this field when it was just starting. So I had a little bit of knowledge about it. And additionally, one of my business contacts that I built over the years is actually John Houston, the CEO of Arvinas. He's from the same town as me in Scotland. So we have and I knew from him as well that TPD was actually something of quite interest. So the combination of that made me think really seriously about Captor, because, not to exaggerate, targeted protein degradation is really one of the next big things in biotech. And I thought the opportunity to be in at the beginning was really an exceptional opportunity that I really couldn't refuse.
Okay, well, it seems that Captor has accumulated quite extensive experience in the business development area. Yourself or Sylvian Cottons have strong business records in regards, among other things like partnering deals or commercialization of drug in the market. Can you please share some of your experience with us and tell what constitutes drug development program attractiveness? What drives big pharma interest? In other words, what is the recipe for signing a strong partnering deal, and what is that it factor in Captor, in your opinion?
I think you're right to pick this point up, because Sylvain really has a huge experience. I mean, he's a scientist, he's not a business developer, but from the scientific side, he's been involved in 2 major transactions. So to have a scientist of Sylvain's quality, who's already been experienced in bringing products to market and doing deals from the science side, together with my background in doing deals from the business side, it's really quite unusual. And what Captor, after all, is a relatively small biotech. It's quite unusual to have such long experienced individuals in the team. So you're right to point that out. It's a huge asset we have. In terms of the magic recipe for business development, there really isn't a magic recipe. It's more a question of an approach in terms of, first of all, you have to work always with the highest quality science. If you don't have the highest quality science, you won't be able to do the business. And secondly, you have to be working in areas where there's not only a great need for patients to have new drugs, but obviously you have to be aware also of what pharma needs, because at the end of the day, from a biotech company like Captor, our direct customers are the pharma companies. In the end, the product will get to the market and will treat patients and will help their quality of life. But the pharma companies, the people we need to deal with to get to the global marketplace. So for me, the key thing is to work in an area which is strongly innovative, with great science, and can really bring new things to patients, but at the same time be working in areas that you know are of interest to pharma. And I think if you do that successfully, you then have the big question, which is, what scientific information do you need to provide to pharma to convince them that your drug candidate it has got a great chance of success in getting to the market? Because we all know that biotech it takes a long time. Drugs sometimes fail. Getting through the market takes many years. So you really have to know what kind of data is going to convince pharma partners. And I think that's where people like Michael and Sylvain, who are very experienced in the science side, can really work very well together with someone like myself on the business side. So for me, I think that's what we have, is that we have even though we're a new company, very young, but we have the experience of doing deals already that will mean we'll be able to design construct the right kind of information packages for these companies to convince them of our products. And by working in TPD, it's well known that virtually all of the pharma companies recognize that TPD is really a new area that they want to be part of. Some of them are working on it internally, but many of them are really keen on doing partnerships with companies. So we think that the fact that we're in what is really, I don't want to make it, to belittle the science, but it really is a hot area. So the fact that we are only the first company in Europe who's really doing an IPO in this area, I think it's really a big opportunity for Captor.
Well, you mentioned you're a pretty young company. You started at 2017, as I recall.
Yeah, 2017 was when we really started constructing the scientific platform. The company was legally founded a bit before that, but 2017 when we really started doing things, and 2018 was when we really started to have the resources to get going.
Yeah, still, if we count that, it's like almost 4 years since you started. But in experience, you all guys as a team, you have like 150 years of experience counted all together.
Yeah.
So if we look at that part of the experience, what's behind you, then I don't really think this that the fact that the company is only 3-4 years old really matters. It's the people that are behind the company, not the company itself.
And actually, what's interesting is we do have that extensive experience. So many of the things that Captor is going to experience, either Mikhail Silva and myself or one of the team members have seen that kind of situation before. So we have the experience to at least know approximately what kind of direction we should go in. So that experience is very helpful. But don't get me wrong, we have a huge team of young scientists in the company as well, who are, they're less experienced, but they're full of ideas. So I think this combination of, highly experienced individuals and together with a really creative young team is great. It's great. It keeps us young. Let's say that. Let's put it that way.
Let's keep it that way for the rest of your life. Moving on, Arnivas, a global leader in TPD, released a set of clinical data in late 2020. Chimera initiated clinical data just this year during the Q1 period, and also showed recently another set of preclinical data. Also, C4 Therapeutics presented preclinical data for one of its degraders. A lot is going on in the industry at the moment. What does it mean for Captor? Where is Captor with its development, and what are the near-term goals for Captors? Do you see a place that you can develop in near-term plans and in the future? Do you see as a space for Captor to be that unicorn?
Yeah. No, absolutely. Your question's very, very current. Yes, indeed. Companies like Arvinas, Chimera, and others like C4, who are the other public. There are 4 other public companies in the field of TPD. We are the 5th. The other 4, however, are all on NASDAQ. And I would say, really, the way to think about this, because it's an interesting issue, because TPD technology, all 4 of the companies you mentioned are working in TPD. But actually, strangely, none of them are our direct competitors. And what I mean by that is that they're all working on different drug targets from us. So the drug candidates we have in our pipeline do not compete or will not compete with the drug candidates that Arvinas has in their pipeline, for example, or Chimera, even though we're all using a similar technology to discover drugs. And the reason why that situation can happen is that TPD has such a vast potential for the number of diseases and drugs it can address. It's a totally new way of making drugs. So there is room for many players in this field. We are fortunate to be one of the early players. But to be honest with you, Arvinas, Chimera, C4, I would say we're like a family. We're in the same area, and they're our big brothers. They're about 1 or 2 years ahead of us. So as you say, Arvinas is already announcing clinical data. And we're like the younger brother. But what's interesting that happens is the very news that you mentioned, Arvinas, with their clinical data, that helped the share price of Chimera. That helped the share price of C4 Therapeutics. So it's almost like good news for Arvinas is good news for TPD. It's good news for everybody. And in fact, it just increases the confidence in TPD as a technology. So I am great. I send congratulations to the CEOs of these companies when they announce clinical data, because it's great. It's great news for us. And I hopefully that we'll be able to reciprocate in the next 6 to 18 months. We'll have good news, and that might even be viewed as positive for people like Arvinas and Chimera, our big brothers, if you like. So for me, this TPD thing, and the reason why we had such a lot of interest in our IPO as well, is because of this factor, is that increasingly people are believing more and more in TPD. So every time these companies make an announcement, it's great. For me, it's great. In terms of ourselves, it's quite interesting that our projects are earlier than the projects of these companies. So I don't want to mislead anyone. We're at an earlier stage. As I say, we're 1 or 2 years behind. But interestingly, of the 5 projects in our pipeline, 4 of them are at a stage that is called in the industry lead optimization. That means they're just about to go into preclinical development, which is what C4 Therapeutics announced. So we expect over the next 6 to 18 months, we'll have probably at least one, if not more, of our projects which move into this phase where we have news. We can make announcements. We can make announcements such as we've selected our drug candidate. We have got animal data proving that we do what we're expected to do against tumors. And then, shortly after that, we can announce we're moving into IND enabling studies and that we are getting ready for moving to clinic. So I think the next 6 to 18 months, we'll have to see quite a lot of news flow and announcements from Captor. And I'm quite convinced that our peer companies, our brothers and sisters, will announce also news flow, which will, I think, also help Captor because of what I said. And often what you find is that the good news helps the area, but often even when companies get bad news, and some companies will announce bad news, it's going to happen, but often that bad news is related to a specific drug and not to TBD in general. So I think I'm looking forward to this being an area with lots of news flow, both from us and both from our peer companies.
Okay. Well, at the end, just a few more questions. One of it's regarding your experience in bringing companies to the capital market, as we know. Could you please tell us what your insights are regarding Captor's IPO's process in comparison to other transactions that you took part in previously? Have there been any surprises? Now you're working on Polish market, so I believe it could be something new for you. How do you assess the overall biotech understanding among Polish investors? Are we that different from the global market, or do you see some similarities?
To be honest, I think there are more similarities than differences. Just for background, I mean, the IPOs I've been previously involved in, one was in London and the other one was in Australia. The rest of my capital capital raising has been with venture capital, but I did participate in those 2 IPOs. And I would say that there was more similarities than differences. The situation with the Polish capital markets, I would say, is just like the Polish economy. It's advanced terrifically over the last few decades, really since the opening up of the markets and things really advancing, the European Union. And I would say the sophistication of the Polish capital markets has really changed a lot in my view. I mean, I wasn't here before, but just in looking what's happened, that you've got so many now focus on new economy companies coming to the capital markets. You've got IT companies, gaming companies, biotech companies starting to come to the market with successful introductions. So although the Polish capital markets are clearly not as big or as sophisticated as, for example, NASDAQ, but nonetheless, it's coming on very quickly. It's maturing quickly. And I think the companies that are now coming to the public markets in these areas I mentioned, particularly gaming has been very successful, but also IT and biotech. These companies are now coming with technology, innovations, and business models which are at the international level. So I think the Polish stock exchange, the Warsaw Stock Exchange, as far as innovative companies is concerned, is a relatively new player, but it's really growing very quickly. And I would not be surprised if this idea of unicorns appearing that started out on the Polish market, I don't see why that can't happen, to be honest with you. And you may well end up with companies doing what I experienced in the UK, which is often you saw companies who would raise money and become established in the UK, even going public on the London Exchange, but eventually doing a dual listing and going on to NASDAQ. So I don't see why Polish companies can't do that kind of thing, as long as they have great science or great technology and an excellent business model.
Okay, we're just about to see you to be placed on our Polish stock exchange, as you mentioned, and according to the recent news, your plan is to possess in the beginning the amount of just over 180 million zlotys, which is equal to just over 40 million euros. My question is quite simple. Because on one hand, some can say that's quite a lot of money, but in biotech, you count it slightly different. How much, for how long do you reckon it will be enough for the money that you're gonna get for the company? Is that for a year, for certain projects that you're now working on, that you mentioned previously that there will be some news later this year?
I mean, first of all, you're right when you talk about the amount of money raised. I mean, in terms of the new share issue, we raised about 150 million zlotys, which is around about $38 million. So by comparison to, say, an IPO of a company like Chimera, we're quite a bit less in terms of the actual amount of money raising. But I think it's important to realize, first of all, we are earlier stage. Our project costs at the moment are relatively lower. The other thing is that we estimate that doing research in Poland, quality research in Poland, is around about 20% less expensive than doing it in the US. And then thirdly, not to underestimate it, is that's only talking about the new share issue. We have secured quite a significant amount of non-dilutive funding through the EU and Polish government programs for supporting innovation. And that actually increases our budget available for research by quite a lot in terms of giving us a length of time we can work on. So we actually have a significant amount of non-dilutive funding, which is not too much less than the amount of money raised in the capital raising. So we actually have, relatively speaking, more resources available to us than at first glance when you look at that. So our budget for the coming years, rather than being limited to 38 million, is probably more like over $60 million. So we're beginning to talk about sums of money which are more interesting. Coupled with the lower cost of research here in Poland, we think that is definitely enough to take us to the milestones that are in our prospectus, and invite anyone who's interested in the company to look at the prospectus, where we describe that we expect to take one or two of our programs to the first phases of clinical studies in the next couple of years. And also, as we have already done at the end of last year, where we entered into a collaboration with the Japanese listed company, Sosei Heptares, we also expect to enter into a number of additional collaborations over the next 2 years as well. So I think we are confident that the amount of money we've raised now will take us through to the stage where we sign additional collaboration agreements, which will themselves bring additional finance to the company. And in addition, we should not forget that we actually have a reasonable budget for the next few years as well. So we don't have a specific view of the moment of necessarily needing to come back to the capital markets within, for example, 2 years or whatever. We feel that because in our budgeting, we have enough money to get to these milestones, which will increase the value of the company. When we have our pipeline projects approaching the clinical phase, that increases significantly the value of the company. We may well even have some license agreements. So we don't have a fixed strategy of additional raising, but we certainly can. We have budgeted things well. We have successfully got the top range of our IPO. So we know that we can have sufficient funding to get all our milestones achieved. And then we may even have additional financing from collaboration agreements in the interim.
Well, Tom, thank you very much. We'll be looking forward to get some more news and insights from Captor later this year. And also we'll be looking carefully and closely about the Polish stock exchange to see how the Captor is doing. I wish you all the best. Thank you very much for having you in my videocast today. I hope you will agree, and next time in a few months we can meet again for some updates of how you're doing.
Yeah, I would be delighted, and thanks very much for the questions, which good questions, I have to say. So thanks for that. And I'd be more than happy to come back at another time. Thanks very much again for the invitation.
Tom, thanks once again. Thank you very much for watching, and I'll see with you in the next video cast. So till next time, goodbye.